Hi folks, Dr. Hartl here. Today we're going to talk about viral upper respiratory tract infections. If you'd like to know more about what a virus is, you can see the links that have been provided with the notes. Viral upper respiratory tract infections are super common. They're also known as colds. There are thousands of different viruses that can cause the typical symptoms of fever, cough, and congestion. It's almost never worthwhile to test for those specific viruses because we don't have any medicines for them anyway, and the immune system's going to fight it off in a week or so. Viruses generally have an incubation period that ranges from anywhere from 3 to 10 days. That means the virus is growing inside of you, but you're not having any symptoms yet. There's generally a portion of time when the virus is being shed, so it's coming out of you, but you're not experiencing any symptoms yet, and you are contagious during that period. Symptoms generally start when you start causing damage to the upper airways, and two things basically happen. So the upper airways start getting damaged, and you get symptoms from that, and the immune system turns on to try to fight the virus, and you get symptoms from all of those things. Those symptoms can last anywhere from a day or two to up to 2 weeks. It depends on a lot of factors, how much virus you got exposed to, the type of virus, and whether your immune system has seen it before. You are generally contagious throughout the period that you're symptomatic, and you can actually continue to shed virus for a couple of weeks after symptoms have gone away. This is generally why we don't recommend that kids stay home from school when they just have a runny nose or a cough, because they've been contagious for 2 or 3 weeks, and sometimes before they even knew it. And studies have shown that keeping kids out of school has never really demonstrated any effectiveness in decreasing the spread of the virus. Now, why would you keep your kid home from school? So there's generally 3 things. So if your kid is having a fever of more than 100.4, frequent vomiting or frequent diarrhea, you probably want to keep your kid home. That's when they're going to be really contagious and shedding lots and lots of virus. So that's when we recommend that kids stay home from school. The mainstay of treatment for viral upper respiratory tract infections is supportive care until the immune system can find the virus and clear it. We don't have a lot of good medicines for viruses, and antibiotics such as amoxicillin and azithromycin are designed for bacterial infections, and they won't do a lot of good if you have a viral infection. Taking them when you have a viral infection just puts you at risk of the side effects, things such as rashes and diarrhea. So we don't generally recommend them when you have a viral infection. So the first thing to know about fever is that fever is not inherently dangerous to you or to your child. There are a lot of different ways to check for fever, which are kind of beyond the scope of this video. If you'd like to know more details, you can see the links provided with the video. Fever is generally defined as anything more than 100.4 degrees Fahrenheit or 38 degrees Celsius. Fever is a very well-controlled process in the body. When the body gets infected with something, it sends signals to the brain saying, hey, we need to heat up. And then the brain sends signals back to the body telling it how much to heat up. When we give medicines such as Tylenol or Motrin, we interfere with those signals coming from the brain. But then when the medicines wear off, usually after about 4 hours, the signals are still there most of the time, and so the fever comes back. Cough is one of the more frustrating symptoms that parents have to deal with. It's generally worse at night, and we don't know why that is, but it keeps your kid from sleeping, which in turn keeps you from sleeping, and it's a very, very frustrating symptom. It also tends to hang on even longer after your kid is feeling better, so it's a very frustrating symptom. The other thing that's frustrating about it is we don't really have any good medicines for cough. There are a lot of over-the-counter medicines that are available. None of them really work very well, and some of them can be dangerous to kids, so we don't recommend any of them. If your child is older than 1 year old, you can try a little bit of honey, just raw dark honey. Has been shown to decrease cough. It's probably not going to take it away, but it should help blunt the cough a little bit. Do not give honey to kids that are under 1 year old because there's a risk of botulism. You can also try humidifiers in the room or steam showers. If you are using a humidifier, make sure you're changing the water regularly because mold can build up and that will actually make your child's cough worse. The most common problem after a viral infection is a secondary bacterial infection. So your immune system has two basic modes. It can be fighting viruses or it can be fighting bacteria. And if it's fighting a virus, then it makes it more susceptible to a secondary bacterial infection. That bacterial infection can happen anywhere, but common sites include the ears, ear infections, lung infections, pneumonia, sinus infections, or neck space infections. It's hard to anticipate all of the symptoms that can produce, but some of the things listed here are concerning, and you should see your provider if that occurs. The other thing to return to see your provider is if the illness lasts longer than 2 weeks. The immune system will almost always fight something off within 2 weeks, so if it lasts longer than 2 weeks, go back and see your provider. There aren't many vaccines for the viruses that cause upper respiratory tract infections. The one exception to that is the influenza virus. The influenza virus does cause an upper respiratory tract infection, but it tends to be much more widespread, much more contagious, and also much more severe, and that's why we vaccinate against it. We do recommend that everybody get the influenza vaccine, especially if there are vulnerable family members in your household. If you'd like to learn more about the influenza virus or the influenza vaccine, you can see the links that are provided with this video. Generally washing your hands pretty frequently and not sharing utensils and covering your mouth when you cough should prevent spread of the virus.